This is my client, Diana, who flew from Cedar Rapids. Des Moines, from Des Moines. Okay. For therapy at Hesch Institute in Aurora, Colorado. And she's going to tell us her story and her response to treatment.
So I injured my SI joints and my hamstrings probably 6 or 7 years ago, and had a lot of tendinosis throughout the glutes, had a lot of hamstring pain, SI pain, and pelvic floor pain. Had a lot of physical therapy, chiropractor, and ended up getting platelet-rich plasma therapy done and prolotherapy in those areas multiple times. It seemed to resolve the issue, but in the last 3 years I developed this rotational pattern, and I couldn't really figure out what was going on, and I wasn't sure if it was related to the injury I had, but I did fall multiple times on the ice on different occasions, and never really thought anything of it until I came here. I just was not getting better with my other physical therapist. I had been in physical therapy for 5 years, and I did find a really good physical therapist in Des Moines, and he was really just keeping me together and keeping me out of pain, but I just was not getting better. I was to a point where my mid-back was locking up, my neck was locking up, just due to my body being in this rotational pattern, and I could barely walk. I cried every day. I prayed every day. I never thought I was going to get better. I honestly was at my wit's end. I didn't think I was ever going to get better. And my doctor was going to send me to a pain specialist, which I didn't really want to do. And I had been watching Jerry on YouTube for over a year, and I just knew that this is the person I needed to see. He knew so much about the sacrum, and I knew that I was diagnosed with a sacral torsion, and I knew it was much more than just a sacral torsion, because everything I was experiencing was so different than just a sacral torsion. So I made an appointment to come see Jerry, and within 15 minutes he diagnosed me with a lower windswept pelvis, and of course I had a sacral torsion and a lot of the other diagnoses I had received before. But it was that missing link that I needed to get that rotation out of me, and literally within, a half an hour I was walking, my back pain was gone, my mid-back had popped. For the first time I always felt like I had a knife in my back. For over a year I had a knife in my back, and that had resolved. Saw Jerry for 3 days, discovered more areas that continued to be just resolved, more mobility, and I have hope now. I have hope that I'm going to get better. Going back to Des Moines and working with my physical therapist, and just now being able to strengthen the areas that have become weak. So, I was a really strong athlete before, and my identity really changed over especially the last 3 years, not being able to run, not being able to lift. So now I have hope that I can actually be able to be the person that I was before, and be able to start a family, actually have kids, and not be scared that am I ever going to be able to lift my children. That was one thing I was actually really worried about. What is going to happen to me? So,
And you notice when you would bend down to lift something, you'd notice that your pelvis would shift off to one side.
yes, when I would bend over, my entire pelvis would shift to the left, and then I would get really bad low back pain. And I couldn't help it. I could not bend over straight. When I would sit down, I could not sit straight. I had to sit in a rotated pattern, and if I tried to twist, it was like my body the whole thing would move. I couldn't isolate the twist. It was just stuck. Everything was stuck. So, and the tailbone was definitely not in the right position, and I knew that for a long time. So, I'm hoping that now that I'm in the right position. I went for a walk yesterday, and for the first time in years, I didn't have to lay on my back. I didn't cry. I didn't have to complain that my back hurt, or that my mid-back hurt, or that my neck hurt. It was very freeing to actually enjoy my day and not be in pain. So it was wonderful.
And the lower windswept pelvis that you presented, that pattern, it's described in other YouTube videos I've posted. And I think yesterday's video was informative about what that is as well. But it's not in the literature. It's a pattern I discovered, so it's in my book. when I teach that pattern. And it seemed like that was a missing piece for you.
Definitely, definitely. I cannot say enough how much it helped me. I can tell you it has been years, and this has been, I mean, I've been to physical therapists that wanted to send me to psychiatrists. I have people that have told me I'm too hyperactive, that I overanalyze things, that I think about things too much, and that's why my muscles are tight, and that I just need to calm down, and that's why everything hurts, and that I have fibromyalgia, and that you know, I overanalyze things. And so when you hurt, of course you're going to overanalyze things, because all you want to do is get out of pain. So I was constantly searching. That's what I spent my entire day doing. I went to work, I came home, I was searching for answers. Well, let me try this exercise, let me try this exercise, let me try this stretch. And it was to a point where that's all I did. My boyfriend would come over and he's like, what are you doing? Of course, yeah, you're stretching. Every morning, 2 hours just to get out the door. To go for a walk took me an hour and a half just to build that mentality up. Because I knew when I went for a walk, I was going to be in pain. And I knew when I came back, it was going to take me 2 hours to get out of pain. So it was consuming my life. And I didn't know how much longer I could take it. So I can't tell you enough how much Jerry helped me. And I'm so thankful I came here. And I just recommend that if anybody has any sort of back issue and is not getting better, that you need to come see him, because it has definitely changed my life.
One of the unique things we do here that you have not experienced before is the spring test. Can you talk a little bit about the spring test and how that was helpful?
Yeah, so, you know, when I describe this to a lot of my therapists, is like I tell them, you know, when I always feel like when I push my pelvis in or push my back in, it just feels like it's stuck. And one thing that Jerry does is that he'll lay you down and he'll spring each joint to see is it moving. Well, I was not moving in multiple areas. I was not moving in my pelvis. I was not moving in my rib cage. And you know, when he freed my area in my sacrum, it translated all the way up through my rib cage, through my neck, and so those areas could move, could mobilize. And so then when I was walking, I didn't feel the need to say, oh, I'm stuck anymore. Like it actually, because it was moving naturally when I was walking. So he tests all of those areas to make sure that when you're doing activity, you're going to get that rebound effect, you know, when you're doing activity and not just that force going straight to that joint. And that's what I felt like. I felt like when I did a squat, the force would just stop right in that hip joint and not translate throughout the rest of the body. And the rest of the body would take the load because you can't transfer the energy. So I'm really glad he does all those tests. So he discovered multiple throughout my body that were stuck and helped me. He taught me how to free those spots myself if they got stuck again.
Yeah, so now you're independent. You don't have to keep coming back to see me.
Correct.
Very good.
Very
Well, I'm very encouraged by your response, and thank you for letting us film you.
Mm-hmm.
And thanks for letting us film the windswept pelvis, because it's helpful to teach others about that pattern.
Mm-hmm. Thank you very much for helping me do this on my own. So thank you.
You're welcome.